Yeah.
Okay, perfect. Our staging account, of course, it is not real. Some of the information that you are going to see here, it's a fictitious, made up people. Once you create your account, you have a home end page. You could always make this your default page if you like to. It has all of our newsletter, all of our trainings, any updates that you may see for this month or the following month, you will see it here. You also have an FFM account integration clock, and then you have your certification center. This will allow you to see all the FFM training when it's available, as well as if you do Georgia, you have SBM training as well. You'll have any notifications up top. You have your plan year enrollments, which gives you an estimated submissions by date and compare plans. You also have an enrollment comparison. And then if you ever need help, we have our agent support team right here. You could either give us a call, email, or we do have a live chat feature available as well. If you do Medicare, we do have a Medicare platform as well. It is completely free to you. And you could also be under BenaVest as your main upline. Under your clients page, it's where you are going to find all the consumers that you currently have enrolled through the platform. This will show you the consumer's name, the carrier plan, the gross, the net, also the effective date of the policy, documents if they're needed, and then the payments. Under actions, you could view, you could either change the plan, send an intake form, fill out an intake form, or you could archive it if you're no longer working with this consumer. We also have a new feature, which is the bulk email for clients. You could do a bulk intake form. This will go to your clients. You have an updated subject line here. You could always customize that if you like as well. And then you have a pre-filled email at the bottom with the intake form. The intake form, it's for you to be able to send this to consumers, especially for OEP. They could update their information. Once they update the information and you're in their application, you will have a side-by-side view of the information they sent over to you, and you could just copy and paste. You also have a client check-in email that you can select the clients that you want to send it to. Again, you have your own subject line, and then you have the email of the body right here at the bottom. You could always send yourself a copy as well. And then you also have a birthday greeting. You could select any consumers that you like on the birthday side. You could tell them happy birthday, it'll show their names, and then I'll have your information as well. You also have the access to import or export if you ever do need to pull that information. Up top, you have several reportings, like all clients. This is what you're looking at. You have your client follow-ups. You have your renewals. It'll show you who is coverage at risk, subsidy at risk, coverage changes, right? If there's any changes on that policy, as well as premium changes. You have AOR at risk. Documents too, you have the intake, right? You could always send the intake form from here as well. You could do all your clients or specifically to renewals. And then you have your invalid action error. This is where you are going to see if there's any consumers that you have been working with that have hit that invalid action. Under leads, it's where you are going to find consumers that you either started quoting or consumers that started quoting themselves or an application. They could do this by utilizing your marketing tab link that I'll share with you shortly. Here's where you're going to find those consumers. It's going to have their lead, the plan if they had selected any, the last time they looked at their account, and then the status. If they're confirming they're already on the last step of the application, but yet they haven't completed. Therefore, you could always click on resume, reach out to the consumer, and see what happened in that application that they weren't able to complete. Also, it'll say applying. If they are applying, it's that they're already in the application process. Therefore, you could always reach out to them and let them know, like, hey, you didn't finish. Let's go ahead and work together. Exports, it's where you will find those quick exports for you. If you need to see them in a Excel, you could do that. All you have to do is click on export and you will receive an email with a link where you could download that information. You have an Insights tab. Your Insights tab shows your monthly activity, how many leads versus how many applications submitted, as well as your average plan premium and annual plan premium. There is a date range up top that you could always change depending if you want to see what was your volume for OEP. We have a bonus tab. Please refer to your agency in regards to the Enrollee Assistance Program. The Enrollee Assistance Program, it's made specifically for agents that are licensed in a state but are not appointed with a carrier. The way it works is that they go ahead and submit an application. However, HealthSherpa will be the agent of record and the agent will receive a one-time payment. During open enrollment, it's up to $150. It's $100 after a 45-day waiting period, and then $50 after the policy's been active for 6 months on the book. If it's an SCP policy, it's up to $50. The reason I say up to it's because it does vary by carrier. If you see at the bottom, it says view carriers that pay $25. Okay. So once you do that, you could pull that carrier list. You also have Medicare referrals. If you choose to refer a Medicare potential client, you have to view and agree to the terms. Once you view and agree to the terms, a unique phone number is going to populate for you. That phone number you will provide over to the consumer once the consumer calls in, and if they do get a supplemental or an advantage plan or a Part D dental vision plan, you would be compensated. It'll show you at the bottom how you could track your payments, okay?